just going to start with a quick question, which is, what brought you joy this week? I can see the recording started now, so thank you, Paul. And hopefully, if this works right, should be able to see responses on here. If you missed the QR code, don't worry, you can still enter at the top of the meeting there by entering pollev.com/danw706 in your browser.
Shall I tell you, Dan, what brought me joy this week?
Yes, please do.
It was learning not that you had bankrupted yourself voting for Lithuania at Eurovision, but that is the European country for which there are the most overseas residents in the UK, and that is why Lithuania always come at the top of the UK vote in Eurovision. I was very worried for you.
Eurovision is a big deal in my household. The year evolves around it, so I'm still living off the joy of that Eurovision Song Contest. Apart from no points for England, very sad. What brought me joy this week is realizing that you can add emojis to a word cloud.
Is that you, Dan, with the little dog?
It's not. No, somebody else has discovered it.
It was me, guilty.
No, mine.
See, who'd have thought that in 2021 the QR code would have made such a strong comeback, and that we'd all be able to do everything off our phones now?
Absolutely. This is looking really good. I'm just going to take a quick snap of this, Rich, and then shall we get going?
Oh, sorry. Do we know how many are likely to be in this session, just so we know we've got everyone?
I was keeping an eye on the numbers. It doesn't look to be going up any.
Yeah, it feels like it's plateaued, doesn't it? And that's a lovely number. It's just right.
Okay. So colleagues and fresh air, I think, are the biggest numbers amongst dogs and beer. So right, we'll kickstart then with the presentation and we'll get going. And thank you. I'll keep this open so we can always come back to this at the end. Okay, brilliant. Right, let's make a start. So hello, everybody. My name's Dan Wadsworth, and I'm joined today by the lovely Professor Rachel Pilling, who's on the call as well. And this is our introduction to 15 seconds, 30 minutes, and it's a social movement all about joy in work, as the introduction told you there. So we'll jump straight in, but just a couple of things before we do. If you've got any keen tweeters amongst us, we do have our Twitter handle at 15s30m, and we do have the hashtag join work. So please do tweet along, take pictures, and we'll get to them afterwards as well. So who are we? So I've kind of introduced ourselves. That's a picture of us if you can't see us before, and we're based in the lovely West Yorkshire. We're quite near each other, and me and Rachel worked quite closely together on a couple of topics, but Rachel will tell you a bit more about that as we move along. So what are we actually going to talk about today, and what are we going to teach you about? A couple of bits and pieces. So we're always going to start with why. So we're going to talk a bit about our purpose. Always a good place to start. Rachel will talk to you about the role of join work and why it's vitally important to quality improvement, and not just quality improvement, but all aspects of improvement work. We're going to hopefully rerun another little bit of the poll that we just did around why do we work here, and that's where we get the opportunity to reconnect with your job and what brings you joy. Learn a little bit about what a 15-second mission is, and also then talk to you about the realization of the knock-on effect of a mission. And we talk a lot about cogs. You might see our logo is made up of a cog, because we like to think that, you know, you're doing something small which has a knock-on effect of a larger system, and a larger system of cogs. COGS also stands for Creators of Great Success. So it's super, we love that. And also then, you know, how to launch that mission and be a 15-second hero, which you can see Rachel has got us on her background. I'll let you guess who's who. And then we're going to do a bit of how you can share and spread the idea a little wider. So our purpose, what does it all mean, and what's it about? So it's 3 easy steps really, and it really is as easy as this. The whole purpose of the 15-second social movement is about spending 15 seconds on a task now. And by doing that, you're going to save somebody else 30 minutes later on. And by doing so, you reduce frustration and increase joy at work. So it's about small tasks that save somebody else, not yourself, but somebody else more time and less frustration later on. As we start to talk around these 15-second tasks, that's what we call our missions. So that's what we mean is this is our 15-second missions of creating joy in work. So that is our purpose. But I'll hand over to Rachel now, who'll talk to you a little bit more about how did the story begin.
Thanks, Dan. So our story began back in 2017. Dan and I had worked together on some outpatient improvement projects, and we're applying for an NHS Improvement Award. And we needed something that was not dull and would keep us interested for a year, let alone win a prize. And we couldn't think of anything. And then one evening, we had the light bulb moment. So every day before she goes to bed, I ask my daughter Maddie to clear all her clothes from her bed and her chair and her floor, so that we've got a nice clear bedroom. And she does this by sweeping everything into the wash basket. Clean or dirty, in it goes. So one day I said, Maddie, if you just spent 15 seconds putting those clean socks I've just brought upstairs from the utility room into your drawer, or those jeans that you've worn for 20 minutes, put them on a hanger in your wardrobe, you'd save your dad and I half an hour in washing. That's a load of washing that we wouldn't have to put in and out of the washing machine, on and off the drying rack. Let's pretend we're ironing, and then back in your room. So Maddie thought what she was doing was achieving her KPI. She was clearing the clothes off the bed and the chair and the floor, but the way she was doing it was creating work for someone else without her really even knowing it. And we realised that this is going on in every organisation in the world, is that somebody's doing a task which is inadvertently creating work for someone else. Well, actually, if you did something slightly differently that took you a tiny bit more time, you would save this person a bit of time so they can then do something more interesting, helpful, and that saves someone else and someone else. And suddenly you've got this benevolent cycle where you know that within your team or organisation, there is someone doing something that is reducing frustration for you and bringing joy to themselves and to other people. Because it's in doing the task for someone else that you bring about joy in work. And a controversial statement such as it is, but that creating joy in work is actually down to each of us. So the social movement was launched, and this map of joy was where we were perhaps pre-COVID. We're now in over 170 NHS organisations. We spread internationally. We're on recently on International Quality Improvement Forum. So this is the real deal, and you won't be alone if you join us. So let's talk about where this fits with quality improvement. Now, we don't talk about quality improvement much because we fill that gap for people who don't have formal quality improvement training, but 15S30M is absolutely QI. So there's patient safety, there's doing it right, there's cost effectiveness, doing it well, but there's also joy in work. These are 3 elements of quality improvement. And actually, joy in work is often left to one side. It's felt, well, let's get it completely safe and completely cost effective, and then we'll look at the joy in work. Whereas actually that's upside down. If you address joy in work, the other 2 will automatically improve. Let's move on down to the next slide. So why is it so important? Well, we feel with the current wellbeing movement that they are behind the times, because Dan and I have been banging on about this for nearly 5 years now. Joy in work is the single biggest factor in patient safety and experience. If someone comes to work with a smile on their face, then the patient perceives a better quality of care. Staff burnout and exhaustion is the largest threat to the future of healthcare. That was in a report in 2016, and we can only imagine how that has progressed since then. And so where does this sit in the QI world? Well, Edward Deming, who is the grandfather of quality improvement, said people are entitled to joy in work. So this underpinned everything he always said. So joy in work is where we need to start with quality improvement. And Dan is going to tell you how you can increase joy in work where you are. Thanks, Dan.
So yeah, back to our purpose, like Rachel said, it just we'll keep seeing these slides, you'll keep hearing us talking about it, because I think it's really good to keep that repetition going about what it is we're trying to do here. It's about small actions to save somebody else so much more time later on, but by doing so reduces that frustration and increases that joy in work. So back to the point of number one, how long is 15 seconds? So we'd like to introduce you to the 15-second challenge. What we're going to do is I will say go, and we will try to count 15 seconds. And then what should we do, Rich? Should we do hands up? I think we can do it on here. So you can put your hand up on Teams.
Like that.
Yeah, just like that. And then we can see, and then we can really start to see how long 15 seconds is. So on your marks, get set and go. Oh, got hands up already. Yeah, and that's where we are now. There's still some people with their hands up. Very good. So that's the amount of time which we're talking about here. We're not talking around huge, big improvement setups. We're not talking about governance arrangements. We're not talking about anything about. We're talking about what can you do in 15 seconds. And it might surprise you what you can do in those 15 seconds. You know, for example, there's all sorts of stuff that that you can do. Is, you know, if in 15 seconds you can click a mouse 30 times. You can update details on the computer. You can easily type 30 words, recording patients, you know, allergies, for example. You can speak 30 words to, you know, share any ideas, or say thank you, or pass the recognition on, or just help somebody else who's lost in the corridor. So this is the kind of time frame that we're kind of talking about. So it's really small actions. We won't hold you to, you know, if it takes 16 seconds, fine. If it takes a minute, sure, but it's just the small things that you could do today that give somebody else a lot less frustration. So we'll jump into some examples, because I'm sure you're eager to find out. So give me some examples of what we've been doing. And it's a pleasure to say that you're already doing it. So there's a big piece of work that you've already been done. If you've not seen the videos here, we'll make sure we share these slides with you. We've got the links on there. But these are a couple of examples already, which you're already doing across Click or North Cumbria. So you've got the various people on there, and these are some of my favourite absolute missions. The one from Suzanne there around email signatures and making the updates on their email signatures with the links to this event, so people could actually start to see that, which makes it all the easier during her emails and things like that. Emails are a big thing for us anyway. We had one of our best 15-second missions was a big launch at Bradford, where we and Rachel are originally from, about making sure that your email signature had the correct mobile number on it, the correct address where your office was. Little things like that, advanced annual leave, really little things that could make a difference. From Dr. Amit there as well, about the text message template, speeding up the how long it's taking to send the text messages out and reply as well, really, really quick things. And the one from Karen there that she talks around having these readily available forms, the referral forms in GP consulting rooms, not having the GPs to have to leave the room, come back in the room, leave the room, come back in the room. So these are the kind of things, and we've got a few more examples for you on here, which I think Rachel's going to chat through.
Thanks, Dan. So this is Leah, who at the time we first met her was a healthcare assistant, and then became a nurse, and then a ward sister, and now is matron. And when she was running the I ward, she decided to do a few little 15-second, 30-minute missions. So the first one was just some information cards, just on the ward with the ward phone number. She realised that the visitors at that time were asking, can we call the ward? But the staff didn't know the phone number. They knew the direct call, but they didn't know the full length phone number. So every relative who came onto the ward was given a card with the phone number on. That stopped them asking, stopped them feeling they were interrupting nurses to ask for it, and made patients and relatives really feel cared for. She had set up the hostess on the ward to make cups of tea for relatives while they were waiting for day case surgery. And she was really, really good at the keep it tidy trays, just making sure at the end of each ward station, things were put in one place. So when the doctors came on the ward round, everything was in one place and went back to one place. It's the simple things that just keep the day flowing and stop you feeling, oh, this is so frustrating. And here's another example, and this is from Northampton, who really, really took off with 15S 30M a year or so ago. Simple things like putting labels on keys. Any of you who've worked in a ward have stood in front of a cupboard and tried each of 16 keys trying to open a cupboard. 15 seconds just to put a keyring labelling which was for the utility room and which was the oxygen. Hugely reduced frustration for the nursing team. This one is from Bristol. So this was one of the doctors noticing that the colleague who topped up the scrubs stores every day just laid them in a particular way. And it's a great example of someone who is a 15-second, 30-minute hero, just ninja within the organisation, who just does this, doesn't think anything of it, doesn't think they're doing anything special, but just lining the scrubs up such that it's easy to take them out in order so that they're not jumbled up makes such a difference. And he said, if it just saves all the doctors just 10 seconds, that adds up to a lot more time spent with patients. That's exactly the spirit of 15S 30M. So how does it work? Well, there's lots of different ways you can get involved. You can do what we did. We stood on a hospital corridor and outside the Costa Coffee and M&S Food at lunchtime. And we just said to people, what is frustrating about your job? What do you find really irritating? And what little thing could make your day better? And that is how we collected our first 100 missions in 100 days. It's people just suggesting little things that would make a difference. You can run a workshop similar to what we're going to do bits of now. All the stuff's on the website. There's little videos showing you how you do it. There's little videos of us doing some of these bits, so you don't have to talk it through yourself. Again, with groups of staff, helping them re-engage for why they work in healthcare. We show how the smallest tasks make a big difference, and you'll feel that through the workshop activities we're going to do next. Or you can just do a little mission yourself. Is that you can decide, I'm going to do this small 15-second task that's going to make a difference to someone else. Every time a patient checks in, I'm going to make sure we've got their right phone number. Every time someone in the corridor stops me looking lost, I'm going to say to them, can I help you? Shall we go together and find, I've no idea where cardiology is, but I can find the information desk, and then we can help the patient. It's those little things that really make us feel like we've done a good thing, and therefore we've had a good day. So what is a 15-second, 30-minute mission? There aren't very many rules, but there are things that just help you stay on track. Well, it only takes a few seconds. Really important, you don't need lots of meetings or emails to make it happen. And we've got some examples in a minute. It's important to know that it shouldn't need lots of extra resources or setup costs. Often there's a few little things you can do that make it flow, like the keep it tidy trays. They bought a few trays, but that's the minimum setup cost. Something that will reduces frustration for staff and patients and increases joy in work. So we can't run a full workshop today, but we can give you a taster of some bits of it, and Dan's going to talk through that for you now.
Thank you. Okay, yeah, so like Rachel said, this is just going to give you a little bit of an intro into what we'd actually run at the workshop. So if you wanted to go away and run this with your groups of staff or your own team, then you've got the experience to do so. But we like to start this with reconnecting staff to what brought them joy in work. And actually, why do they work here? So we've got a couple of the questions which we tend to run through. And we've got these reconnecting joy questions. So we're going to ask 3 questions. We're going to do, why did you decide to work in healthcare, and why are you proud to work here? And the most meaningful part of my work is. So if you've still got that browser open on your phones, then you can still go back to the questions. If not, I've put the QR code back up here again so you can scan onto that. And I'll leave that up for a couple more seconds, and then we will jump into the questions. So, question number 1 is going to be, why did you decide to work in healthcare? So again, if you missed the QR code, you can enter it at the top here, pearl.ev.com. And why did you decide to work in healthcare? Excellent. You can actually vote for these little answers if you wanted to move on. Give something back, that's brilliant. Making a difference, helping people, definitely put the top there, which is brilliant to see. Making valuable contribution, lovely. Some top votes coming through now, which is really good. Brilliant. Excellent. So that's really lovely to hear. We love thinking that because it's very easy to forget sometimes why you decided to work with the job that you're doing, especially when it's as hectic and crazy as it can be. All right, we'll move on to the next question then. Thank you for that. We'll make sure we take some snaps of all these and we'll share these back with you all as well. So question number 2. So why are you proud to work here? The people, absolutely brilliant. We work together to make a difference to people's lives. Excellent. Supportive and efficient team, these are brilliant.
And it's really important to draw out from staff why they're proud to work where they do, because it's easy just to get into the why job is hard and why it's a bit rubbish. But most staff are inherently proud to work for the NHS and proud to work for their teams. And doing this part of the workshop really gets the mindset where we need to be for them to be able to find ideas for missions that can help them show that pride.
We do actually in the workshops then we move it on to talk about the frustrations, but like Rachel said, we have to limit that because people are it's so much easier to talk around frustrations without, we like to flip it on the other side and get them in the right mindset to be thinking about the joy element and, you know, creating that spark again. Brilliant. And then we've got one more question for you on here now, which is the most meaningful part of my day is.
Yeah, connecting with colleagues. 15S30M is unashamedly a cross-organisational tool. We know that so much of quality improvement seems to be clinical, but Dan is an admin background, and I'm surprised he's not mentioned it yet because he normally bangs on about it. It's so important. At the workshops, on the very first workshops we held, we had 2 secretaries, we had 2 IT workers and 2 members of the patient booking team, and it was humbling hearing why they'd taken jobs in the NHS when they could have worked anywhere, and the impact that they felt they were having on patients. And it really it's a really powerful thing to do, is have a mixed workshop, not all from one team, because it really strengthens those bonds between people.
Yeah, that definitely worked. And yeah, I'm admin and clerical through and through, and I've seen, you know, what bad administration can do to a healthcare organisation. So talk to any admin colleagues; they will have ideas, lists of ideas of fantastic 15-second missions, which are brilliant. Excellent. Well, thank you so much for looking through those questions. That's been brilliant. So we'll move on now to some other elements of the workshop. So that was, do keep those questions coming in. If you think of them, we'll come back and take some pictures of those as well. That was just the questions on there. Okay, so we're now going to talk around Rachel's going to talk to you about the knock-on effects. So linking back to those cogs which we talked about earlier, what is the knock-on effect of a mission, Rachel?
Thanks, Dan. So this 15-second mission that you're going to do that will reduce frustration and increase joy in work, it will spread much farther than you think. And we're going to talk about Carol. Carol had been to one of our workshops and she works on the reception desk at the eye and ENT clinic. And one morning she came in and there was a power cut. So the blinds, the shutters were stuck down and the lights were all off. And she'd been told it would be fixed, but after 9 o'clock. And so she thought, well, what can I do that would reduce frustration for the very many people who are about to have an awful day? So she stood right by the doors of clinic, and as patients arrived, she welcomed them and she said, clinic is on, we're going to fix the shutter, don't worry about the lights. Can I have your name and date of birth? And then passed it behind the shutter where there's a little door where there was one computer that was working. And we could log patients in, book them into the electronic system, and we could send them into the waiting room where the lights were working. And that meant at 9 o'clock, when the computer switched on, the patients were ready to be seen by the medical team. So what did Carol do there? Well, she didn't wait for permission. She didn't fill in a load of forms. She didn't wait for someone to tell her to do this. And in fact, the other members of the team saw her doing it and came out to help. And so 2 or 3 of them were standing at the front. So what is the knock-on effect of that mission? Well, she was able to make sure that patients didn't go away and leave thinking the department was shut. That meant that loads of patients didn't need to then be rebooked by the admin team if patients had left and gone away. It meant that there wasn't a huge queue of people waiting to book in when the screen suddenly did open. So that meant the clinic began to run to time, and so that was a lot less stressful for people. It meant that the clinic ran as close to time as it could do, which meant that the afternoon theatre lists could start on time. So that meant we didn't need to cancel surgical patients. It meant that the pharmacy didn't have a big glut of people all queuing for medicines at lunchtime. It meant that patients got out of the car park space so someone else could get into the car park space, because we all know it's the most common cause of complaints in any acute trust is a lack of car parking. So the knock-on effect of what Carol did was huge, just from these few seconds thinking, I know what I can do to reduce frustration. So what should have been the worst day of the month actually turned out to be the best, because the staff on front desk were absolutely buzzing about this fantastic thing that had happened. And it did spread because the shutters stick about once every 8 weeks, and the staff instinctively now, we stand at the front and we write down names, and it just happened. So there's no standard operating procedure, there's no rules, there's just, we know what the right thing to do is. So on this one, we're going to let you do the hard work and talk about the knock-on effects. So this is Gareth, who works for Yorkshire Ambulance Service. He came to our first festival that we had, and he said that his 15-second mission was going to be when he picked a patient up in the ambulance to bring them into hospital, he was going to just check that they had their glasses there. Do you wear glasses? Make sure you've got them and bring them with you. So if you want to put in, are we doing it in the chat box, Dan, or are we doing on the QR?
Go with the chat box.
Chat box. If you want to put in the chat box what you think the knock-on effects would be for a patient bringing their glasses into hospital when they might otherwise have left them at home. What are the positive knock-on effects of that? Yeah, excellent. So it means that they can read while they're waiting to be admitted or waiting for their appointment. Yep, reduce patient distress. Any of you who suddenly find yourselves without your glasses, it's very distressing. It can be very disorienting. Anything else? Great. Reduced risk of falls. Absolutely. Yes. This, when we were doing these missions, it was right at the top of PJ paralysis, if you remember that. And it meant that patients were more likely to get out of bed if they can see where they're going. And as Dan likes to say, don't find themselves in the wrong toilet, because they can see which toilet they're going in. They can read information signs. We all know, those who wear glasses, you hear much better when you can see. so you can understand what people are saying to them. And absolutely, whoever R is, Rebecca, thank you. The family members aren't having to go home, find a key, break into the house to bring the glasses in. So this knock-on effect that Gareth has had is can have a huge impact on length of stay, on quality of care the patient receives. It makes it much easier for the patient and the ward. Yeah, this is great. You've got the hang of it now. So this is the sort of thing we're looking at. You need to really think when you're producing your mission. It's what makes you keep doing it. Is thinking there's a huge knock-on impact. It's definitely worth spending these 15 seconds because I know I can be saving lives by doing this. Yeah, more empowered and like a real person. You're right. It's very it's a loss of dignity and confidence when you don't have your glasses. That's brilliant. Dan, is there anything you want to add?
These have been some of the best knock-on effect missions we've had so far from lots of groups. So this is amazing. Thank you, guys. Yeah.
So over to you, Dan.
Brilliant. So yes, that slide again. What is it? It's 15 seconds now to save somebody else 30 minutes later on, reducing those frustrations and getting back to having some increased joy in work. So, my mouse got a little bit ahead of me there, sorry. So I'd like to introduce you first of all to the TARDIS. So like we've been going through some of those examples, which have been really good examples because the glasses, the shutters, the other little missions we talked about, the key examples, the stuff that you guys have been doing already have been great, but sometimes people can get a little bit too excited and want to change the world. Now, me and Rachel often try to change the world, you know, every single day, but unfortunately it doesn't fit into the ethos of 15 seconds, 30 minutes. So we developed the TARDIS, which I think we actually developed on a plane at one point, flying around with lots of paperwork. Yes, Paul, definitely. Doctor Who fans among you will love this. And the reason we kind of came up with this is because it will help you kind of look at the idea that you want to improve, look about the 15-second mission. And what we say is if it's small enough to fit through the TARDIS door, as you can see from the stuff we've done already, the knock-on effect can be endless. So if you're thinking about your idea, think about, does it fit in the TARDIS? Is it something you can do today? Not having to wait around, not having to, you know, wait for tomorrow or next week. Is it something you could literally do today or tomorrow? It only takes a little time, 15 seconds or so, a small action. It reduces frustration for yourself, for your colleagues, for your patients. It can be at home as well. It could be family as well. It doesn't have to always be at work. You don't need permission. You don't need to have any approval forms. You don't need to ask, you know, get this signed off by anybody. It needs to be something that's small enough that you can just do without permission. It increases the joy in work, which is the ultimate purpose. And it's shareable. It's something that you can easily share with your colleagues and somebody can pick up your idea and run with it. As we always said, you know, one 15-second mission, if that's all that happens today, there'll be a benefit. But imagine if there were 50 15-second missions that happen today, what could it be like? So we think about the TARDIS there, and also to really help with focusing about where the 15-second missions could be, we've come up with the famous 9 slide, which me and Rachel like to refer back to a lot of the time. These are all on the website, and when we bring this up, and we'll leave this up mostly when we're actually reviewing and getting to the end of the workshops where staff can come up with their 15-second missions, because we like to think of it, you know, these workshops are the ideal time for people to have some thinking time as well. There's too many workshops where it's just being talked at and more of a lecture, but we like to leave this up so it can really just resonate with the people who are working at the workshop to come up with their missions. These themes are some of our favourites that have happened so far from our 100 missions in 100 days. So we like to flash this up to really get the juices flowing and people to really think about what could you do today. So some of our favourites on there: replace, that's been a really key one. Photocopiers, printers are really key there. We still do work with a lot of paper, you know, just taking a wedge of paper to the printer every time. Or people have come up with laminated cards that sit, you know, in the middle of the paper. So actually when it gets to that, you know, it's a reminder to reorder. Letting somebody know is a really key one. And most are key with patients. You know, if there's a delay in clinic or they tell the patient what needs to happen, that can be really, really easy. Rachel mentioned it before about don't be a dead end. You know, if people are lost on the corridors, don't just say you don't know. You know, it's about taking them to somebody who can find out, or to the relevant desks. And, you know, recognise is another one that I really, really like to do. Just a simple recognition to those staff members, giving them a voice and letting their idea be heard. And it's also got the word cog in the middle of it as well. So that's always a benefit. So yeah, these are some of the ideas which we like to flash up. So that we like to leave this up as people are coming up with our 15-second mission pack. And we do like to say that this is probably the easiest action plan or mission pack in the NHS, and we've not been proved wrong so far. So this again is on our website. So it's a really easy way for staff to fill in some ideas about what brings them frustration, what brings them joy, and then they can actually write in there what their mission idea is going to be. And this is what the mission pack looks like. So it's nice and simple. It's just about writing what frustrates you, thinking about how you can flip that round. So what could you do to reduce that frustration and increase the joy? We have the famous cogs. Now, when we do an actual mission, we actually have plastic cogs where staff can write. I feel like if Rachel might have one to hand. Yes, she does. Oh, it's just on your screen. I think it's these are little plastic cog sets where people can actually write down those knock-on effects, like you've done in the chat group there. But we write them on so it's a visual of how big the knock-on effect is from your 15-second mission. And get to twirl it around. Thank you, Rachel, my very glamorous assistant there. Again, really important for staff to see that it's not just something small, it's something small but you're having a huge knock-on effect. And then you can write in there about what the mission is going to be, when are you going to start it, today, and literally put a tick in the box every time you've done. Again, you can download these mission packs and you can run the workshops, but you know, sometimes staff are just eager to get going with it now, which is no problem. If you've got ideas, get these into these mission packs, and we love to hear back about what these 15-second missions are across anyone that's doing this. We're really big on Twitter, so we do like to be tagged back on Twitter because we do find there's like a hidden community of people who are launching quality improvements, and there's a really big following on there. And it's great to share that idea so people can have that knock-on effect. As Rachel described at the beginning, 15S30M was initially a Bradford-only internal project, and it wasn't until somebody said, you should launch this on Twitter, you should share these ideas, where people started to really pick it up. You can also then, by doing that, you know, you become a 15-second hero. So we do like to award out, we've got little badges we can send out, and we do have some little metal cogs which people can wear on the lanyards. And it's just that small reminder that you've done something small to save somebody else a lot of time. We've got the 15-second mission heroes on our website as well. And that tick in the box is as far as we go with measurements around there. So Rachel's just got a little slide on measurement, which can be often a hot topic.
Thanks, Dan. So quality improvement rules say that you have to measure everything. If you can't measure it, it's not worth doing. Well, you can't measure joy. It's impossible to measure joy. And so we say, just do your 15-second mission. But if you did want to measure things, well, here's an example of how we did it with these clinic setup boxes. So the nurses used to have to go 6 trips forwards and backwards in and out of different cupboards to set up each of the eye clinic rooms. And instead, they've got some boxes, they put all the equipment in, and they found a cupboard and stacked them up. And we said to staff before we introduced them, how frustrating do you find it setting up the clinic? And they just out of 5 gave us a score, 1 to 5. We then introduced the boxes and said, tell us, how frustrating is it to set up clinic? And you can see from the graph that before on the red line and after on the green line, there was a great reduction in frustration. But what was more interesting to me was their comments, particularly this one on the bottom right. I used to stress about getting it all set up at the start of the day. Now I look forward to arriving at work. That person used to arrive with dread every day, and now they don't. And an unexpected knock-on effect. They can tell which rooms have been cleaned. So before they used to have to knock on every door and say, have you finished, have you finished, have you finished? If the box is back in the cupboard with a room number, then the room has been cleaned down and is finished. And we have new staff or agency staff there. It's just go and find the box in the cupboard and put it in the room. It's much quicker for them to get on board with what it is to set up the clinic rooms. So we've now got 10 minutes for you to come up with your missions. So yes, Dan's just showing the little videos that we've got on there, how quick it is to move it. So you are the best person to ask how to make the way your work is better. That is you. We can't tell you. You know your own environment. So we'll put up the little 9 slide again, but it'd be really useful to see in the chat box your ideas of 15-second missions that you're going to launch in the next few days, or what one thing are you going to do that will begin to introduce this to your team? And it might be just have a conversation with one person. It might be to join Twitter and tag us and a load of other people and go, what do you think, guys? So yes, what is your 15-second mission that you're going to do this week? And pop them in the chat box.
We haven't actually talked about the TED Talk. I was just thinking that. So as Rachel mentioned, we do have, I think we've got some slides coming up in a minute, but we do have a YouTube channel as well with some quick and easy missions in an animated form that you can do. But we do actually have a TEDx talk as well, which is a 15-minute version of what we've done today, a bit more consolidated. So yes, do thank you, Paul, for sharing that. So yeah, do have a look at that.
Are there any more missions? Creating a folder. Excellent. Now, Dan, we have a history with folders. When we first started, I was in charge of admin, and that lasted about 6 days because I created a folder called supporting documents. And Dan said that this is not an appropriate name for a folder because inside supporting documents file was everything. Yes, Dan very much. Dan is in charge of admin now.
I'm totally in charge of admin now, and yeah, folder management is something I'm very passionate about. I'm very, very clear about it because it really actually can help, a big amount. We had a lot of this, didn't we, Rachel? Do you remember, I think it was Bradford, and the IT guys, knew it by their nickname. So, they would put in the acronym or the abbreviation of what that was supposed to be in that folder. Well, nobody else knew what that abbreviation meant. So just something as simple as that, or numbering, 1 to 10s or things like that can be really, really helpful. And yeah, nobody needs a supporting documents folder.
It was interesting, wasn't it, with the IT guys, because they said they were frustrated that people would ring up and ask for the help file that showed them how to do certain things. And they said, why do they ring us about that? Why don't they just find it? And then I said, but it's called SOP 1.3.6621. They don't know. So they went and relabeled all their files. Yeah. And then I don't know if you all have smart cards to go in the computers to access things. Amazing chap called Gary. Go and find Gary Mudge. He's amazing on Twitter from Plymouth. He said that instead of somebody emailing him to ask for a form, and all the form had to say was the person's name and email address. So he gave them a form on which they put their name and email address and sent it back to him. You're thinking, but I already know their name and email address, so I'll just put their name and email address in the form, and then I'll send it on to be processed. So his 15-second mission was just to cut out a whole layer of paperwork, and it sped up the length of time to get an access card from 21 days or something down to 6. It was just incredible the impact that had.
That was really good. One of my favourite ones that I've heard recently, actually talking about the revival of the quick reference code, was actually from Bradford, wasn't it? So there's a lady, Charlene, if you on Twitter, and so she came up with adding a quick reference code to a piece of tape which goes on the casts in orthopedics, and depending on the QR code and the type of cast, the patient can just scan the QR code. It gives them all the information that they need to do, directs them straight to the website. All the questions are answered from there. Just such a simple idea, which was just fantastic, and it's really taken off. And I've started to see that in a lot of my other areas. So I think I've been back to hospital sites recently, and I always, I think at least once a day, come across a soap dispenser that hasn't got any soap in it. And actually, you know, that's something we actually should do. And then it was down at Maidstone actually, and they'd added the QR codes onto the soap dispensers. So is this soap dispenser empty? Scan this QR code, and it alerts the cleaning teams immediately that there's one empty. Fantastic. You know, rather than having to wait for that cleaner to actually go around all the toilets and everything, to make sure, you know, it's reported upon much quicker. I thought that was a great idea.
Super. Shall we move on, Dan? So we're definitely finished on time.
Yes, I was thinking it's 20. Yeah.
So this is Carrie Biddle, who was perhaps the original 15S30M hero. She's from Royal Cornwall, and she's now Health Education England AHP lead. And she immediately took 15S30M, and she excelled and she helped us learn how you introduce it into a hospital, really. So she's done a poster on it. So lots of hospitals, Northampton have done a similar thing, Plymouth have done a similar thing, of actually using our approach, but making it into your own and presenting it at events. And showing the impact of 15S30M is not difficult at all. So who is this aimed at? Well, it's everyone. We say from chief executive to porter, but actually we know that most quality improvement training is directed at senior management or ward managers. There's very little QI training for band 2, 3, 4, 5 staff, and yet they are the majority of the workforce. So we need to find ways that those golden people, the people who are just incredible and do their job so superbly, help them capitalise on that, help recognise it by awarding them little cogs. So just, I don't know if you can see it, tiny little cogs, just buy them from Amazon and they can put them on their lanyard. They're really inexpensive. It doesn't cost you much at all to do that. But they are the people who make the difference closest to patients, and they make the biggest difference to patients. So this is for them. So Dan, final couple of slides.
So yeah, linking it back to, again, that purpose of the joy in work element of it. So back to Edwards Deming, you know, they create a system in which everybody may take joy in their work, and it works because it works. You know, that small little missions do really make a huge, big difference to people. And the other thing it does help as well, which Rachel mentions, you know, it's for everybody. With the thing we say about 15S30M, it's accessible to everybody, but it does help bridge that gap between the leadership and the workforce. Me and Rachel were very conscious that when we, you know, came up with this social movement, that the best people on the ground they've come up with the ideas and see 100% of the problems, 100% of the time, are people, the porters, the cleaners, the administrators, the receptionists, your AHPs, your junior doctors, people like that. Rather than just being told from the leadership you need to launch a quality improvement method, we want you to aim it from the inside out, not top down or even bottom up, just from that middle bit around to get the most reach possible. So a little bit just before we end there, what can you do next? How can you get involved? So lots of links on here. I'll leave this up for a bit so you can take some pictures, but we have an email address, info@15s30m.co.uk. If you email into that, you get a bounce back, or we'll send you an e-starter pack, which is kind of all our best bits and all our links from the website to get you started, including somebody, I think it was from Northampton, who actually set up and launched it within 10 days of hearing about this mission pack. And that was a launch in their organisation, which was brilliant. If you Google 15S30M TEDx, there's our little 15-minute TED talk. You can run the virtual workshops like we've talked through today. We've got our website on there, and we do have a YouTube channel for some inspirational videos, which is just search 15S30M. Or if you got some, well, as we can see, you've got some fantastic ideas raring to go, just launch them. Just go with it and see what happens. But don't forget to tag us back so we can at least, congratulate you on selling that and actually send you some cogs out, send you some badges, and really congratulate you on being creators of great success. And even if it's just spread the word, if you do nothing today other than just speak to somebody else, one more person that says, actually, I heard of this 15S30M thing, and it sounds really good. The more people who join in, the sooner you'll create more joy in work. And that's the end of the presentation. Thank you so much. We've got about 5 minutes left if there are any urgent questions. If not, I'll just say thank you very much. Rachel, anything else to add?
No, you've been fabulous. We've had to learn how to do this virtually. We're normally full of energy and bouncing around, and it's quite it's been very different learning to do it virtually, and this one's worked really well. So and it's down to the delegates. So thank you very much for being so engaged. Oh, thank you, Nicola.
Thank you.
So we might just flag up one other person. So Julia Wood was in this slot as well. She's incredible lady from Seaside. She's part of the Q network and she's the real Join Work person. Do go and find her Join Work stuff as well because it is absolutely exceptional. So if Join Work is your thing, do go and look at her resources as well. Julia Wood, she's called.
Yeah, she's been great in supporting us, and yeah, fantastic.